Dr. Zorba Paster is here taking your calls at 608-270-9933. And we'll start with Maya in Madison. Hi, Maya. What's your question?
Well, about COVID, two of them. If you have had COVID, how quickly can you have that Omicron booster?
The new booster, I can't remember what the CDC says now. It's like 30 days?
Yeah, I think
you got to look it up exact, but it's roughly a month. If you call up either Walgreens, CVS, or your doctor's office, they'll tell you what the CDC recommendations are. I can't remember exactly the number of days, but you have to look it up. And the reason I don't remember is they actually change it on a periodic basis.
And you're immune if you're
immune, you're actually good for 90 days. So in one case, it was actually you could wait 90 days before you got the immunization. But once again, I would go cdc.gov and say, when can I get the booster, and you can find out, or your doctor.
Next caller, Barb from Portage. What's your question?
Yeah, I'm calling about getting some kind of medical help because I'm trying to get like a phone.
Okay, don't listen to your TV. Just talk to us.
Yeah, I'm trying to get the medical thing that I need on my phone so that I can get the proper care.
Like a medical ID, kind of?
Yeah.
Okay.
Medical ID. So the best thing to do is call your physician's office, physician, nurse practitioner, your professional provider. They'll be able to give you the information because it's all local. Or call your senior citizen center. Local senior citizen centers have a social worker, and they work exactly on these things.
And if someone's calling you, that's probably not a good sign because...
No.
That's probably maybe
you call them. Yeah. Call the senior citizen center. Talk to the social worker in your local area. They have tremendous amount of information about this stuff.
All right, let's go to Armando in Reedsburg. Hi, what's your question? Armando, you there?
Armando, yes.
Go ahead.
The power of attorney forms that he's talking about, and they be purchased somewhere or get them from the doctor?
It's free of charge. All you do is put down Wisconsin, W-I-S, Wisconsin, and you write down Power of Attorney for Healthcare, or POA, and it'll pop you into a PDF file. You print it out. So you can, anyone who has a printer can do it, or you can go to your library. They'll be able to help you and print it out. Does not have to be notarized. All you have to do is have two witnesses who actually do not have to get anything from it. Very simple to do. Everyone should have them. And librarians, social workers at the senior center know how to do this.
It will be on channel3000.com if you want to print it out.
It's free of charge.
Free of charge.
All right. We don't have a caller on line 1, which is gone now. So let's...
Do you want me to call in? Ask a question? Here,
let me see here. We're having a little trouble here.
But I think it's amazing because...
Okay, we got it here.
We have someone. Okay.
Right. Julie in Madison. Julie, you there?
Yes.
Go ahead.
I was given Paxlovid for when I had COVID, and I'm wondering if I got it again, are you allowed to take it again?
You can take it again within a certain amount of time. And once again, the CDC changes how often you actually can take it. But basically, if you get another case of COVID and you have symptoms and you meet the criteria, age-wise and disease-wise, whether you have diabetes and so on, or an autoimmune disease, that will also determine whether or not you get Paxlovid. But the answer is yes, you can have it more than once.
All right, let's go to Peggy in Brooklyn. Hi, Peggy. Go ahead.
Yes, Dr. Zorba. I had COVID about 2.5, 3 weeks ago. I'm totally boosted except for the latest booster. And I didn't really lose my taste, but the only thing I want to eat is salt.
Salt.
And I'm super dizzy all the time.
Well, there are a few things. First of all, sweet, sour, salty, and bitter you taste with your tongue. Everything else you taste with your smell. So if only thing you taste is salt, that means that your sense of taste is probably depreciated, and as a result, over time, 99% of the people do get better over time, but it's a problem.
It is such a strange virus, isn't it?
So strange. So strange. And so unpredictable.
The symptoms vary person to person?
Person to person, how sick you get, and whether or not you actually recover completely. But most people who lose their sense of taste do recover.
Get boosted and get your flu shot.
Absolutely. Absolutely. Time is to get it.
Time of year.
All right. Zorba, thank you. We'll see you next time.
Pleasure to be here.
Thank you.
Thank you all for calling in.